So without their effort, please come on the dais. So without their effort, it was not possible. Last the 1.5 month, they worked tremendously, and they made it possible for this journal to be seen by us. So really, their great efforts must be appreciated. So with that, I request the formal opening of this.
Hello. May I request Honorable Minister to formally open the journal, and other dignitaries on dais, please join her.
This journal is published by JP Brothers, a very renowned publishing house in India. So thanks JP Brothers for their support as well.
Please, I'm not sure. Ladies and gentlemen, it was the formal inauguration of the Journal on Recent Advances in Pain. Thank you, Dr. Das and other doctors. Now, may I request Honorable Minister to share her views with us.
Good evening, ladies and gentlemen. It's a pleasure to be a part of this inaugural program where you would be holding a conference, international conference, on the recent advances of pain. I'm sure that this conference will be a very successful conference because this is being chaired by two ladies. I know and I believe that when there are the hands of ladies working together, the ultimate aim will be fulfilled and will be a successful one. So let me first of all thank you all for choosing this venue for holding your conference. From the end of the state of West Bengal, and on behalf of our Honorable Chief Minister Mamata Banerjee, I welcome you all, and I would say that you have a very pleasant stay here and reach the destination you want to reach at. Pain is a very important sector on which the doctors have to dwell upon, and many eminent doctors are on the dais, starting from a very senior doctor, Dr. Bhattacharya, and we have a doctor from Bangladesh. We have so many medical luminaries here. We have Dr. Gautam Das. I was told that 20 countries from the world are here participating in the workshop, participating in the conference. And if you really want to give relief to a patient, it is very necessary to have a total control on the pain management. I am not one of the medical fraternity. I know very little, but I know that I am in the midst of the living gods. No human being has seen God, but it is nonetheless true that it is you who stand beside them when they are in the most troubled days of their life. So I really feel that you are the living gods and you know how to manage and give relief, how to treat the patients who come to you. I need not say much. But the state of West Bengal is beside you. Our Honorable Chief Minister, she is always eager to help this sort of programs. And Partho, who is coordinating today's program, he also knows. Our Honorable Chief Minister will be happy to be beside you when you hold such programs. And as I know her, if you want any help from the end of the state government, she will also extend her hands of cooperation. So I feel that you proceed and you reach at your destination. You all are so eminent personalities. You have given me a chance to be in the midst of this august gathering today. I thank you all. And I, from my end also, I can assure you, whatever help you need in future, I am ready to be at your side, and our aim is to totally remove pain, eradicate pain from the entire society, from the entire world. You all have come. Again, I thank you all. Have a very, very good stay, nice stay here. Though it's a monsoon season going on, we are having often rains. Even then, rain is also a part of a beautiful life, a beautiful part of life. So you enjoy the rains here, the monsoons here, and you reach at your destination. Thank you all.
Thank you, Didi. Thank you, Honorable Minister, for being with us here, sharing your valuable time with us. And we have another guest of honor this evening. He is old in age, but young in mind. I have been seeing him enjoying the entire program from the beginning, Dr. Shailendra Bhattacharya. May I request you to share a few words with us?
Thank you for calling me and bringing me here. But I am so happy to see so many delegates from all over the world, mainly Southeast Asia, as far as I can see from the face, who has come to attend this conference. Now, I tell you, pain is a thing. It has been treated even in the ancient areas, ancient times, the pain has been treated in their own way, But it has gradually it has come to a stage when by research and by elimination, it has come to a point when things are done for specific treatment for a specific pain. And that's very important. I remember one thing. In my fellowship examination in England, there was a question, 1 hour question, that is management of pain in advanced malignancy. So I had to write 1 hour on pain on advanced malignancy. So I had written everything as much as possible, as much as I could. My knowledge went, but later on I said that a few kind words are much more important than other management for pain. So doctors should be very kind. Doctors should be such that patients can have faith on you. And that's the only way, or the best way, to relieve pain. And in addition to the pain management, what Dr. Das has started in Kolkata, I'm really happy. I'm really happy, and I adore Dr. Das for doing it, though he is much younger to me. But he started his career from my place, and I always supported him. And I still feel that he should be great, and everybody who are in the specialty must come up and don't localize yourself. It's very important. Today I attended the last part of the discussion, and I found the etiology is very important. Etiology of the cause of the pain, to find it out and then see it. So I don't want to say many more, but I am so glad that all of you have come and helped us in Kolkata for this conference. Thank you very much.
Thank you, Dr. Bhattacharya, for this nice speech. As you have mentioned, one of the reasons could be that you have found most of the Southeast Asians attending this conference is they're easy to recognize. But I think it's not an odd time to mention here that ICRAPAIN 2015 has participation both as faculties and delegates from Egypt, Oman, US, UK, Colombia, Sri Lanka, Indonesia, Singapore, Nepal, Hong Kong, and last but not the least, from Bangladesh. My request, Dr. Devjyoti Datta, Organizing Secretary, ICRAPAIN, to give us a vote of thanks.
Good evening. For all conferences, even the smallest, needs a lot of efforts. And a conference like us, like this conference, is an international conference that requires a lot of efforts from not only one people, but many, many and many more people. And here, I want to thank everybody. So first of all, thanks to Mrs. Chandrima Bhattacharya, our Minister, Health Minister, for coming and joining this session. Dr. Shailendra Bhattacharya, the living legend in orthopedics, not only in India but also in abroad, who is a great and came with all his difficulties to here, and he also joined us as a special guest. Then we have our Pain Society, ISSP, being an associate partner of this event. Bangladesh Society of Anesthesiology also being a part of this event. Paramadeepak Hospital, Indonesia, and MD Pain Clinic Center, Pain Practice Center in US. So they have extended their hand to make this conference successful. Next is definitely all international